Good morning, students. Hi, how are you all? So let them to go for next topic. So already I given some assignments. So if you are go through that one only, this and all we can understand. Okay. So kindly go through this content, everything. Okay. So today we are see about skull injuries. So skull injuries means already I told anatomy physiology people should study. So mainly that front is frontal bone, then mandibulate, maxilla, nasal bone. It's a normal, okay, cyanotic bone. So it is normal. Here that functions under occipital lobe, peripheral lobe, frontal lobe, temporal lobe. So this is under they given. Okay. So here what are the in the brain what are the sensation will be there like this they're mentioned. Okay, so kindly we'll go through that. So here that what are the function is there like this and all you can go through to the anatomy physiology functions and structures. Okay, so here normally we can given to the brain that function what are the area like this they will given. Okay, so that is frontal means always it's covered to forehead, that forehead place is high everything premotor. So this is and all we can go through that physiology studies. Okay, so mainly here three classification is there: scalp injury, skull injury, brain injury. So if anything in the spine also it will be happen, it's connected to brain, right? So it will be affected. So scalp injury is many blood vessels. So any scalp injuries may bleed profusely that control bleeding with direct pressure. So skull injury means skull injury fracture in a cranium to the face. So it's a severe enough the crunch injury is to the brain. Okay, brain injury is the it's a classified direct or indirect that injury to the brain occur open head injuries. So this is normally that skull injuries are 4 5 types is there. So concussion means it's a direct blow to the head in gunshot wounds and violent shaking of the head through the whiplash type of injuries. That's why we are telling to nowadays children's anywhere lifting and they're putting and playing means we are tell them to don't shake like this and all we are telling. Okay, then contusion is a front, it's a bleeding of fruitus to the brain. It's caused by a direct impact to the head. So this one we can see if you are anyone getting high injury near high to high eyelash eyebrows any getting in that bruise color we are seeing. So that is a contusion. So the penetration and the shaken of baby syndrome, then locked in syndrome. This throw three topic I given to assignment. Your people going to clearly detailed you can study with the three symptoms. Okay, so here already picture is there, maybe according to the picture your people can understand. Okay, so what are the risk factor means mainly that color blindness will be there, alcohol addiction, youngsters, vertigo, then males, females, certain brain injury, young children's, teenage especially 15 to 19 years, certain military personnel, for example parastoppers, then those and all. So mainly it will be affect. Okay, African Americans peoples. So etiology common cause of end injuries means traffic accidents, falls, physical assault, and accidents at home, work, or outdoors while playing sports. What are the signs and symptoms mean dilated pupils, changes in behavior such as irritability or confusion, trouble to walking or speaking, drainage of bloody and clear fluids to the ears and nose, vomiting, seizure, weakness and numbness of the arms and leg. What are the diagnostic means? Always we should do HP and RBC, WC, normal blood count we can do. Then HP for 13 to 18, the platelet is 1 lakh to 4 lakh 50,000. WBC is 4,000 10,000. So sodium, potassium, then ABG. So PO2, PC2. After ABG we are done, we can identify. Okay, so CT scan we can find that arrow marker which location is the clot the blood we can find. Then MRI. So brain scans, electroencephalography, EEG, then nerve conduction various velocities, and electrostomographic and ultrasound imaging. So what are the normal complication means coma, chronic headache, loss or changes in sensation, hearing, vision, taste or smell, paralysis, seizure, speech and language problems, death. Okay, always initial management ABC. ABC means airway control to entering to the cerebral spine, immobilization with stuffed collar, then breathing, then circulation, dysfunction of disability, external examination. So surgical management, closed injury, open injury they will do, and depressed skull fracture. Okay, so nursing manage, what are the mainly nursing managements? ICP. So intracranial pressure we can always monitor. Okay, then fluid volume deficit we can do, then patient of losses, decreased loss of conscious, so hormonal dysfunction will be there, and risk for injury to related to decreased level of conscious. So knowledge defect regarding treatment of modalities and current situation. So mainly here risk of injuries and fluid volume deficit is this content mainly, you people, I'm telling you can listen, and I will give on twist, because next nursing management I will give to the nursing care plan, so that it will come to here. Okay, then ineffective thermoregulation related to damage of hypothermic entra. So brain only mainly the thermoregulator will do. Then risk impact to skin integrity related to compressed circulation shifting or fluid and intravascular industrial space. So ancestor related to outcome of the disease. So this is and all I'm going to give for nursing care plan. So kindly go through that notes. Okay, so diet plan, the amino acid. So mainly that excessive amino acids will be there. So protein we can repair to the easily wound healing. So protein used for growth and repair maintenance of tissues. Then traumatic brain injury is need for protein 0.555 to 0.73 grams according to the body weight. So other food and all rich fruit, vegetables, whole grains, avoid fat and sodium, because if your sodium if you're giving, that will be ICP level will be increased. So here we can ICP should maintain. Okay, then calories recommend. So here one more topic, Glasgow. What is the meaning of glaucoma skill? You should refer and tell me. So here glaucoma is used for patient patient movements, expression, then high movements, so verbal communications, consciousness. So we can use that glaucoma scale. So here they will mention some 6 to 7, 4 to 5 and all. So this one I want to tell about, but you should people read about glaucoma scale when only it will be, when only it will be knows. Okay, then what are the journals means? Nutrition treatment of the patients with severe traumatic injury. It's a first few months. Then rehabilitation. Then congenital rehabilitation therapy, physical therapy, speech therapies, and mental rehabilitation, physical exercise,